Welcome back to the program, ladies and gentlemen. Well, we will now discuss the World Glaucoma Week, which starts from today, well, actually started yesterday, and ends on the 16th of March. The theme for this year is Uniting for a Glaucoma-Free World. In fact, this initiative is to raise awareness of the leading cause of preventable blindness worldwide, preventable blindness, and that's key part of this discussion this morning. As I welcome to the program Dr. Bhola. He's the Vice President of the Ophthalmology Society of the West Indies and consultant ophthalmologist. He joins us virtually. Good morning, Dr. Bhola. Welcome to the program.
Good morning. Thank you so much for having me.
Well, thank you
very much.
It's a real
pleasure.
Thanks for joining us this morning. Well, Dr. Bhola, glaucoma, it's a term that many are familiar with, possibly for the wrong reasons, but nevertheless, it is a very familiar term, although people might not truly understand exactly what this is. Could you please explain to us exactly what is glaucoma?
So we think glaucoma, in the majority of cases that we see, results from the pressure in the eye elevating, and as a result, that pressure damages the optic nerve over time. And most people who get this type of glaucoma get it in the over 40s, or in the majority of cases actually over 60s. So there seems to be an aging factor that results in the glaucoma developing. So it's very, very interesting that you ask, what is the cause of it? Because it varies. Sometimes we see reasons for it, which we call secondary type glaucoma. Patients may have diabetes, they may be highly myopic, and that puts them at risk. Some people have it because they got an injury to the eye, and it damages the mechanisms in the eye, and that leads to the elevated pressures. So we do see it sometimes when there is a problem in the eye. Let me go back a little bit and talk about what is happening in the eye that could lead to the pressure being unstable or there being an imbalance. What happens in the eye naturally is the eye produces a fluid, and that is aqueous humor is the fluid, and that fluid then circulates in the eye, nourishes the tissues of the eye, and then drains out of the eye through an area called the trabecular meshwork in the eye. So you can imagine that's a fine balance between production of this aqueous fluid and drainage of this aqueous fluid in the eye. And if there is any imbalance, let's say that drainage system we have, just like a sink, it gets a little clogged up. Well, you change the balance. You're still producing the fluid, same amount, but you're just not draining it at the speed that it needs to be drained at to keep the pressure stable. And the pressure fluctuates, it goes up. And that is what we think leads to damage, either pressure damage of the nerve itself or some imbalance in the way blood is flowing to the nerve. And that is what is going on there in glaucoma, we think.
Mm-hmm. This particular fluid, is it made up of various compounds? Exactly what makes up this fluid?
So if you look at all fluids in the body, they would have a consistency to deliver nourishment to tissues. So aqueous humor is very similar to blood, but it just doesn't have the red blood cells in it. But it has a lot of the other components so that it could deliver nutrition, energy, everything else to the tissues, those little fine tissues in the eye needed for health, eye health.
I asked that question, Dr. Bhola, because I'm curious if any of those components are off, if there's a bit more of this component than the other, which really alters the balance of the fluid itself, does that also have an effect on the eye or even on one's chances of actually suffering from glaucoma?
Yeah, so if you have an imbalance in the aqueous humor components, then you're going to have damage to the structures in the eye. And we see it, we do see it in conditions that affect the aqueous humor. Luckily, that's pretty rare. You don't get a lot of conditions affecting the aqueous humor dynamics, but there are conditions, and one of the conditions that really affects the drainage system in the eye is one called uveitis, or it's an inflammatory condition of the uveal tissue within the eye, and that affects the aqueous humor, resulting in a lot of white blood cells in the aqueous humor, and they go into the drainage system and they clog the system. The other condition that affects the aqueous humor and could lead to a similar situation is in diabetes. They get a hemorrhage into the vitreous, which is in the back area. That comes to the front, which is where the aqueous humor is. And then that goes into the drainage system and it clogs the system. So there are conditions that could affect the aqueous humor and then affect the entire dynamics of the eye.
I'm learning that term, aqueous humor. I'm going to have to get that into muscle memory. But I know that you mentioned at the start of the program, who can actually suffer from glaucoma, where it is seen most commonly. But this is a condition that could affect everyone. Are there also any studies or research that suggest it may affect one ethnicity more than the other, or even in the case of those who may suffer from other diseases? I know you mentioned diabetes just now, but for example, cardiovascular disease or anything that may affect the brain, for example, could that also affect one's chances of suffering from glaucoma?
I think that's a great point. You need to know what is the at-risk population, and really for our viewers, that's really important. So we think it's an aging disease. So I think if you're over 40, no matter if you have any of the at-risk features that we're going to talk about, you still should be tested. The good news is the optometrists, the other eye care professionals out there, they test for it. As soon as you go in, they'll check your eye pressure. They'll examine the nerve in the eye, and that's a standard thing that they do before they start doing the testing for anything else like glasses or contact lenses or anything like that. So just be aware, once you go to get your eyes looked at for the glasses, they're going to check everything, and you're going to have that screen. So once you're over 40, it's important, I think, for you to make sure you get your yearlies or your 2-yearly examination done. So that's one, the age. The other group, and really Trinidad, the incidence of glaucoma is higher than most places outside the Caribbean. Once you're in the Caribbean, you're Afro-Caribbean, you're going to have a higher risk of developing this condition than the general population. So just be aware, Afro-Caribbean patients have a higher risk. If you have a family history, that's a really important thing. You're at higher risk because there is a genetic component to this disease. Make sure you get tested. You don't take any chances there. And things like myopia, as we spoke about earlier, diabetes is another one. There are other conditions, eye-specific, things like uveitis. If you had inflammation in the eye in the past, if you had an injury to the eye, you will be at a little bit higher risk. That is a significant injury to the globe that led to some problem, like a hemorrhage on the surface, or you had to go and see the ophthalmologist because the eye went blurry from the injury. Not if you got somebody hit you on your head. That wouldn't really cause it. You have all these bones here to protect you from it.
Mm-hmm. Dr. Bhola, not everyone goes to get their eyes tested regularly as they should. In that instance, what are some of the symptoms that glaucoma causes, so that people can have an understanding? Listen, I have an issue here. I need to go get it checked out.
Yeah, that's a great question. Now, unfortunately, glaucoma is what we call the silent thief of sight. Has no symptoms. You would not know that this thing is going on. It's not like cataract. I'll tell you a little difference here. If you have cataract and you're losing your blindness, it's reversible. That's a nice thing. We could easily do a 10 to 20 minute surgery and we bring you back 2020. If you're losing your sight from glaucoma, it is irreversible and it's silent. It's going on and you don't even know. So glaucoma is something we need to screen for, we need to look for. And we recognize this as a big problem in Trinidad, because we were doing diabetic eye screening for over 5 years, and we were realizing that we were picking up patients who probably have glaucoma, and it was a large number. It was about 10% of all the diabetics we were screening. We had to refer them to the clinic to look for glaucoma. So we decided to change our diabetic eye screening program into what we now call CISU, Comprehensive Eye Screening Unit. We have a whole unit now that goes out and it looks for eye diseases. It looks for glaucoma is a big one, because we know that this is the silent T for sight and there is no symptoms, and therefore people at risk and they don't even know. So I think you ask a really good question there, and the answer is there's no symptoms. It could be going on, and you need to get tested.
That is rather incredible. Wow. I think you may have mentioned it earlier, but if we can get a bit more details now as to whether or not there are different types or forms of glaucoma.
Yes, I know I was speaking about the more common one, which is called primary open angle glaucoma, and that's the one that we've been talking about for the last 10 minutes. There are other types of glaucoma. I'll just say secondary types. There is a cause for it. We see it in diabetics. Diabetes is a hell of a problem for us in Trinidad. It's because of it's nice food we have here, but you have to be really careful. It leads to diabetes. All this flour and sugar that really we love to eat, it really raises and gets your blood sugar out of control, and eventually you become resistant to sugar, and then that leads to problems in the eye. We see a lot of bleeding in the eye. And also what happens is the film at the back of the eye doesn't get the blood flow as it should, and that leads to a condition called rubeotic glaucoma eventually in the front. And that happens because the whole drainage system in the front gets fibrosed and eventually it doesn't work. And therefore you're putting in fluid, the aqueous humor, as we were talking about earlier, but you're not draining it at all. Pressure goes up. And then we have to do an operation to put another drainage system in your eye. It's called a valve, to try and regulate the pressure. But by the time we get to that, you've lost a lot of your vision. So there are secondary causes of glaucoma or raised eye pressure, and those are preventable. You really need to look at your diet, look at what you're eating, really take care of yourself, make sure you exercise so you don't get that secondary type of glaucoma.
Wow, that's a lot of information there. I'm glad that you were able to get into that. I'm curious to know though exactly what are the tests for glaucoma. Early on you were mentioning how you were testing for diabetic eye. You realized, oh hold on, no, we need to send you to test for glaucoma as well. But what are the tests that are available for glaucoma?
So you see, the thing with glaucoma that makes it tricky is that like cataract or something else, we could check your vision and we could tell very quickly if you might have cataract because your vision starts to drop and there are symptoms. In glaucoma, there is no one easy test to tell you have it. So screening, what we've decided to do with screening is to look at two things. We look at the eyes with a photograph, and that photograph really looks at the optic nerve, and we could tell when we look at the nerve if there are any features of the disease present. And the second thing we do is we check your eye pressure against the features that we see on the nerve. And combining these two things, we decide if you need further testing. And if we think that you need further testing from the screening that we're doing, then we go ahead and we do what we call a field test. And that field test tells us how the nerve is functioning. It gives us the function. And we do a test called a scan of the nerve, an OCT, and that will tell us the anatomy of the nerve. So there are testing that we could do to tell how the nerve is working. And basically, those are the standard tests that we would do to determine if you have glaucoma. So as you could tell, it's not an easy diagnosis sometimes when the disease is in the early stages. We really have to do a lot to kind of confirm the diagnosis.
Yes, indeed. And I know that you mentioned this is the leading cause of preventable blindness. So before we even get to treatment options, I'm glad you were able to discuss certain things, for example, such as diet, which will have an effect and an impact on your eye health as well, which is very, very important. But also, this is the thing, you may not see signs or symptoms. This is why you need to get screened or get your eyes tested at least once a year. So that leads me into treatment now. Should someone be diagnosed with glaucoma, I'm assuming it depends on the stage or severity, but what are the treatment options that are available?
So as we were saying, if we pick this disease up, it is treatable. I mean, that is the key here. So let's say we pick somebody up from the screening, the CISU program. They think they have glaucoma. They get referred to the clinic. We make the diagnosis that this patient is either at risk of developing glaucoma, because we have a lot of those, or we look at and we think, well, they have early changes. And in those cases, we could prevent blindness. And that's the key here. And luckily, the majority of patients that I see fall into this group where we are able to prevent them from losing any vision or any significant vision over their lifetime. And how we do that is that we lower the eye pressure in the eye. And nowadays we have two options in this group of patients. One is we either use drops, that is 1 drop at night or 1 drop twice a day in the eyes, and that lowers the pressure. Or we use a laser. And laser, the word sounds dangerous, but really the new laser for glaucoma is very, very safe. And now most places in the world, most first world countries are using laser treatment instead of drops. Because you can imagine if we tell you need to use a drop every night, some nights you go out or something going on, you forget the drop, and then that might continue for a few nights because you get into the habit. So there is a lot of compliance issues with drops, and therefore the laser seems to be the better option because it's so safe. So we are trying to convince people to have the laser instead of relying on the drops all the time. So we use laser therapy and drop therapy in that group of patients. Surgery is usually still reserved for patients who seem to be not responding well to the first line treatment, the drops and the laser. Then we usually have to go to surgery.
Wow. Dr. Bhola, we're running out of time, but this has been quite an intriguing conversation, and I'm very pleased we've been able to have this and to share such information with the public. And I read the release that was sent to me from the Ophthalmological Society of the West Indies. Forgive me, it's a bit of a tongue twister. But it did say that as much as 40% of vision can be lost without a person noticing. It's not reversible, but it does not have to lead to blindness. And we've had a very detailed conversation this morning as the world recognizes a World Glaucoma Week. Dr. Bhola, before we bid farewell, any parting advice that you'd like to share with the viewing public this morning?
Well, I'd like to bring greetings from the society. We have our main event of the year in July at the Hyatt in Trinidad, and we bringing together all ophthalmologists in the region. International speakers would be there, and really we trying to ensure that we make people aware that glaucoma is a condition which could be prevented. So if we could catch you early, we will be able to treat this thing and prevent you from losing your vision. And that is really, really important. So get your eyes tested is the key here going forward. Thank you.
Dr. Bhola, thank you very much for your time this morning. And when we started the interview, it was still a bit dark by you, but I see the sun is rising. So you've spent a lot of time this morning with us. Thanks a lot, and looking forward to the conversation to come during the conference that is to be held later in a couple of months' time. But thank you so much, sir.
Thank you. Thank you. Have a great day.
You too. All the best. Dr. Ronnie Bhola joining us this morning on the program, ladies and gentlemen. Again, what a detailed conversation we were able to have this morning. And I think one of the messages that you need to take from this, well, there are a few. The last statistics I shared with you that you can lose as much as 40% of your vision without really even noticing. And glaucoma is not reversible, but blindness is preventable. Those 2 points are very important. When the message is stressed, get yourself screened. Go get your eyes tested at least once a year. It's very, very important. Believe you me, ladies and gentlemen, you don't want to have to suffer with the consequences later on in life. Look after your health and your well-being so you'll enjoy your life. Anyway, thank you very much once more to Dr. Ronnie Bhola for joining us on the program. And that's it for AM Prime, actually. Thank you very much to all my guests this morning for their time and for their energy. And thank you very much to the hardworking team that we have here in WSN who always make AM Prime possible. Keaton Shaw wishing you a safe day ahead, a productive one. And we'll see you again tomorrow. Bye-bye.